Hello, welcome to Nature Source Care. My name is Dr. Funda Goldman. I'm a licensed naturopathic physician and a yoga instructor. And today I was going to talk about Marma therapy, specifically the Ayurvedic energy points on the middle abdomen. Alright, so let's get into it. A note of caution before, information presented here is for educational purposes only and should not be considered medical advice. For any symptoms that are severe or worsening, please contact a qualified healthcare professional. And it's always important to determine the root cause of any disease to develop a comprehensive treatment plan. Individual cases can vary in terms of treatments that are most effective, and solo therapy, so doing Marma therapy by itself, may not be appropriate and or effective in all cases. Especially since most of these points on the abdomen are related to digestion. You really want to get your digestion, your nutrition straight first. So just a few words about Marma therapy generally. If you haven't heard about it before, it comes from Ayurveda, which is traditional Indian medicine. Ayurveda is more than 5,000 years old, and what I like about Marma therapy is that it's non-invasive. It's very gentle but effective. Marma therapy is considered an energy therapy, and there are 107 Marma points on the body. So with any kind of paradigm that's an energy therapy, so whether it's Ayurveda or whether it's homeopathy or potentially traditional Chinese medicine or what have you, you have to kind of shift your mindset a bit and start thinking about people and diseases, states of health as energy or waves. Okay, so what we're really doing here when we work with these points is that we touch them gently, and it allows the energies to rebalance. Okay, so that's about it. You don't have to push, you don't have to force, you don't have to do a lot. Especially if you think in more of a biochemical or biomechanical kind of way, that type of mindset fosters the thought, the more you do, the better result you get, and that's not necessarily true with Marma therapy, so please keep that in mind. If you're interested in more history about Marma therapy, I have that in the first Marma therapy video I did, Marma Points on the Hand. If you're interested in watching and having an experience of Marma therapy, I made a video, Marma Points on the Hand, where you follow along, so you might check that out if that's of interest. And I actually, my last Marma therapy video was on Marma points for the upper abdomen, so that's available. And then again, I mentioned that, we're dealing mostly with digestion here. So whenever you're dealing with digestive issues, the first thing you really want to do is get your nutrition set first. Because if you're not eating things that are agreeable with you or that are in season or what have you, then that can create a lot of havoc in digestion, and Marma therapy will not be able to counteract all that if your nutrition's really out of alignment. So the video, I have a whole playlist on nutrition. The 4 videos I would start with if you're really interested in getting digestion sorted out. I have a Vata or wind diet video. I have a Pitta or fire diet video. I have a Kapha or earth diet video. Again, this is all related to Ayurveda. In my practice, I would say 70% of the nutrition that I do is Ayurvedic based because it's so effective and doable and sustainable. And then the other video I would look at is the Ayurvedic food combining, because that's also tends to be a big culprit in terms of creating a lot of digestive upset. So I would check out those videos if you're really interested in getting like digestive issues sorted out. And if you're interested in this sort of content generally, I'm good at organizing my videos into playlists, so you can check out Marma therapy playlist, Ayurveda playlist, or nutrition playlist, depending on what's of interest to you. So let's get into this. This video is organized a little bit differently than most of my other videos, because these points, and there's 5 today, there's a lot of overlap, and they're located, fairly close to each other. So let's talk about where these points are first and their names. So luckily all their names are the same, so they're all called Nabi. The first one is like the main Nabi point, and that's right at the umbilicus or belly button. And then you have Nabi 1, Nabi 2, Nabi 3, and Nabi 4 that form a box around that central Nabi point. Okay, so Nabi is right at the umbilicus or belly button. Nabi 1 is in the upper right quadrant, and this is the midpoint between Nabi, the central Nabi, and Yakrut, which I talked about in the last upper abdomen Marma points video. So Yakrut is along the mid-clavicular line, so if you draw a line from the mid-clavicle down through the nipple, right at the edge there where you are kind of jumping off from the ribs into the soft tissue of the abdomen, that's Yakrut. Okay, so midpoint between Yakrut and Nabi, that's about where Nabi 1 is. So a direct reflection of this is Nabi 2. Nabi 2 is in the upper left quadrant, and it's the midpoint between Nabi, the central Nabi, and Pliha. So Pliha is on the mid-clavicular line on the left side. Okay, so Nabi 2 is about midway between central Nabi and Pliha. Nabi 3 is in the lower right quadrant, and it's at the midpoint between central Nabi and the right anterior sacroiliac spine, or kind of the hip bone. You can touch there. You can feel that little knob right at the front of the hips. And Nabi 4 is a direct reflection, so this is going to be on the left side. It's at the midpoint between central Nabi and the left ASIS. Okay, so basically you have central Nabi, the main Nabi, and then you have 4 Nabis, Nabi 1, 2, 3, and 4, making a box around the central Nabi. Okay, so that's how you can find all these Nabis. And so there's a lot of overlap with function. These Nabis act basically with the energies, in Ayurveda they talk about different energies: wind, fire, earth energies. And the energies that these points balance are the Pranavayu, the Vyanavayu, Samanavayu, Apanavayu, the Pachika Pitta, Rantika Pitta, and Kledika Kapha. So this may not mean a lot to you unless you're a deeper student of Ayurveda, but just as an example, Pachika Pitta, for example, Pitta is a fiery energy, and Pachika Pitta is the fiery energy in the stomach, so that you can break down things like proteins. Okay, and all these energies are related to digestion. So the other thing I wanted to mention is that, digestive health is like key, really sort of the base fundamental balancer in Ayurveda. Because you'll typically see when somebody starts to get out of balance, so if they have a constitution that's windy, fiery, or earthy, or if they have an excess of these elemental energies, usually people will start to see those imbalances in the gut first, and then the skin. So the gut and the skin are the two places where you really start to see these energies show up. So like right now, it's the end of August, moving to September, where I live in Connecticut. Basically, this is the beginning of Vata season. So Vata season is fall for us here. So it's cold, dry, windy. And this time of year, I tend to see all my windy patients, Vata patients, they start coming in with all sorts of digestive issues. So gas, bloating, constipation. Those are all windy type digestive issues. So we have to talk about, how to balance that. So, again, all these things are really important. And again, the digestion, if people don't start balancing, they have a chance to balance these energies, like with the diet when it shows up that way. If they don't balance them, then the problem is that this like windy type energy, like right now in the fall here, that windy energy can go deeper and deeper into different deeper layers of the body. So it'll spill into, eventually, if it's chronic enough, it'll start showing up in the muscle tissue or the nervous tissue or the bones or, the reproductive system. So there's these different levels where nutrition sort of has this cascading effect. So that's why digestion and Marma therapy and abdomen is so important, besides the nutrition, what you're actually eating and drinking, and how you're eating and drinking. So it's not just what, but how. But in any case, getting back to the general actions of these Nabi points, so pretty much all digestive stuff. So things like improving Agni, which is the digestive fire, so the ability to actually break down food, and this also includes your appetite. It's linked to appetite. the absorption in your stomach, small intestine, and colon. It regulates functions of the liver, gallbladder, and spleen. It regulates functions of the pancreas, kidneys, and adrenal glands. It relieves abdominal congestion, pain, and discomfort. And then again, because we're involving two major organs, liver and spleen, and here the liver and spleen are really important for immunity and immune disorders and even chronic fatigue. So again, all the nadis are involved with these. So there are differences though between the nadis, so I'm going to get into that now. So the central nadi, the areas of effect is that by stimulating and working with the central nadi, it creates ojas. Ojas is sort of this, how do we describe it? Like this sort of like nutritious juice serum that's created. I know it's sort of an odd thing to think about from a Western point of view, but that's what kind of nourishes the body and keeps it strong, and also provides immunity. Because when we start getting depleted, when we start wearing ourselves down, you know, we don't have that sort of natural luster in our skin. We don't have that sort of, you know, happiness in our minds, and we don't have strong immunity. So that's what ojas is all about in Ayurveda, and the central nadi is important for that. And then again, the areas of effect for the central nadi, so the small intestine, as I mentioned before, Marma points always have local effects. So if you know anatomy, then you know this layout of effects of the different nadis will make sense. So the small intestine, mesenteric lymph nodes, the peritoneum, the omentum, the abdominal aorta. These anatomical structures are right here at the central part of the abdomen, and that's mostly what the central nadi affects. The other thing is that spiritually, from an Ayurvedic point of view, and actually Chinese medicine as well, the umbilicus, or the belly button, is thought to be the entry point of the spirit for a person. So there's also some spiritual effects as well. So this is central nadi. So then if we look at the two upper nadis, so nadi 1 and nadi 2, again, nadi 1 being on the right side, nadi 2 being on the left side. So nadi 1, the area of effect is like things like peptic ulcers, liver, gallbladder, stagnant bile, the head of the pancreas, the small intestine, especially the duodenum, the hepatic flexure of the colon, and then the right kidney and adrenal gland. Yeah. So then you can see that, you know, if you have the reflection point at nadi 2, the area of effect of nadi 2 are going to be the spleen, right? It's directly under there. Anemia, because the spleen is so important with building blood. Small intestine, the tail of the pancreas, the transverse colon, the splenic flexure of the colon, so that area, and then the left kidney and adrenal. Okay, so there's mirror effects there, but again, because you have the liver on one side and the spleen, that's why these nadis have different areas of effect and function. And then if we look at nadi 3 and nadi 4, so the two lower nadis, the area of effect, oh, by the way, nadi 3, another name for it is Undaka, which means cecum in Sanskrit. So you might hear that for nadi 3 as another nomenclature. This one does help with dysmenorrhea, so that's like the one sort of reproductive effect in this whole constellation of nadi points. But it helps with things like IBS, so again, kind of central and lower central digestive issues. The cecum and ileocecal valve are here, it helps with that. The colon, so ama and toxins, constipation, the ascending colon especially. And then it also helps with the urinary tract, so things like UTIs, urinary retention, the right kidney, and right ureter. That's a help with nadi 3. Nadi 4, the area of effect. Oh, again, this point also has a second name, Malashaya, which is means descending or sigmoid colon in Sanskrit. And the effects of nadi 4 are very similar to nadi 3, except there's the reflection point. So the colon, nadi 4 helps with the descending sigmoid colon and the rectum. And then as far as urinary function, it helps with the left-sided kidney and ureter, besides the UTIs and the retention, so the central things as well. So those are your points 3 and 4. So how do you work with these points? What do you do with them? So you know, I wouldn't necessarily do a full Marma therapy session on somebody right after they've eaten because their, you know, gut is churning. If you do have problems right after you eat, the only sort of Marma therapy type thing I would do is I would just gently place your hands on the points. I wouldn't move, I wouldn't massage, I would just gently put your hands on these points if there's problems directly after eating. Because if you start massaging when you're digesting your food, you can actually, you know, create more of a Vata situation. You're going to get more gas and bloating because you might be disrupting the natural process. Yeah, you just want to be gently supportive. So if you're eaten and you digested your food and you want to do massage, then the way you would do that is you would do massage in a clockwise motion, starting with Nabi 3. So you would start in the lower right quadrant and go up, over, and down. And go back and start at Nabi 3, go up, over, and down. And what you're doing is you're basically following the directionality of the colon, going up the ascending colon, then across the transverse colon, going down the descending colon. So you basically will be supporting, you know, going the same direction of what normal digestive function is. There are other ways to stimulate these points. So yoga, actually, you may not be realizing it, but if you're doing yoga and certain poses, then you are stimulating these points. So the kind of poses that stimulate these Nabi points are like Cobra, Bhujangasana, you know, where you're on your stomach and then you lift up your chest and your chin, yeah, and upward facing dog or Urdhva Mukha Svanasana, which is like Cobra, except that you're pushing more with your arms and you're getting your thighs off the ground. But again, because of that bend and sort of a little bit of pressure that you're putting on the abdomen as you're doing a back bend, that's going to stimulate these points. Bow pose, whether it's, you know, Urdhva Dhanurasana or regular Dhanurasana, essentially you're on the floor, you're on your belly, and then you lift up your chest and arms and your feet as well, so you create like a little bit of a bow and you're resting on your stomach. That will also stimulate these points. The thing though is that if you're pregnant or you have low back pain, those poses, Cobra, upward facing dog, bow pose, are probably contraindicated for you. If you're pregnant, definitely contraindicated. If you have low back pain, probably those aren't the best poses for you and you need to modify them. But you could do Sufi grind. So Sufi grind, usually you're sitting down either in a chair or cross-legged, and then what you do is you bring your stomach forward and then you rotate your spine, okay, so that you're kind of creating circles, almost like a hula hoop or like a spoon in a bowl, where you're going from front to side to back to the other side to the front, and you're creating these circles. And you can go clockwise and counterclockwise. And that you can do generally if you're pregnant, you know, check with your doctor, or if you have low back pain, because that's also going to loosen up some of these things. Again, if you have massive low back pain or a slip disc or something, that may not be appropriate for you, so keep that in mind. The other thing with yoga is when you do Uddiyana Bandha, which basically means it's like a abdominal lock, where you draw your breath in and then you kind of, it feels like you're tensing up your diaphragm and you're holding in your stomach a little bit. You're creating sort of an energy lock there, Uddiyana Bandha. That's another way to stimulate these points. So there's different ways to do this. And then finally there's just breathing. So you don't, especially if you're you know, having active issues and you don't want to be poking around in your belly and making things worse, you can do gentle breathing and breathe deep into the belly. And what that does is it draws the energy from, especially your mind, into your heart, because in Ayurveda it's thought that the true wisdom and heart of a person actually originates from the stomach and goes to the heart. So that's another way to stimulate these points, is just gentle, deep breathing. Yeah. So there you go. That's how you can work with the nadis, different ways to do it. So there you have it, 5 more Marma points a day in the central abdomen. I hope you found this helpful and interesting, and hopefully it puts you on a better track with your digestion so you can eat yummy foods and get the most out of them and support your general health. All right, so until the next one, take care. Bye-bye.